The looming crisis. Africa's silent killer, non-communicable diseases. Africa faces a silent, escalating health crisis, one that threatens to overwhelm already fragile healthcare systems and unravel decades of progress. While the global spotlight has historically shone on infectious diseases, a surge in non-communicable diseases, NCDs, like cancer, diabetes, heart disease, and hypertension, is casting a long shadow over the continent, leaving African governments struggling to cope. This looming catastrophe, a stark consequence of skewed global health priorities, demands immediate and decisive action. Dr. Githinji Gitahi, a prominent public health leader from Kenya, paints a grim picture. He warns of a potential collapse of health services in the next few years if the current trajectory continues unchecked. The stark reality is undeniable. NCDs are rapidly becoming the dominant cause of death in sub-Saharan Africa. In 2019, they accounted for a staggering 37% of all deaths, a dramatic increase from 24% in 2000. Projections are even more alarming. By 2030, NCDs are poised to become the leading cause of mortality in the region. This surge is not a random occurrence. It's a direct consequence of profound societal shifts. The adoption of westernized lifestyles, characterized by unhealthy diets high in processed foods, sedentary habits, and exposure to increasingly polluted air, is fueling the fire. The rise of fast food chains, the prevalence of motorized transport, and the lack of access to safe, affordable, nutritious food are all contributing factors. These lifestyle changes are silently undermining the health of millions, leading to a surge in chronic illnesses that place an immense strain on already stretched healthcare resources. The problem is exacerbated by a global health system that has historically prioritized infectious diseases, often to the detriment of NCDs. Dr. Gitahi points to the stark reality. Less than 3% of development aid earmarked for health is allocated to addressing NCDs. This skewed focus, often driven by the self-interest of donor nations, concerned primarily with diseases that could impact their own populations, has left African nations woefully unprepared to combat this emerging crisis. The prioritization of infectious diseases, while crucial in many contexts, has inadvertently allowed a dangerous rise in NCDs, a consequence that's now severely impacting the health and economic well-being of entire nations. The implications are far-reaching and devastating. Overburdened healthcare systems, already struggling with limited resources, are now facing an unprecedented challenge. Hospitals are overflowing, healthcare professionals are overworked and underpaid, and essential medications and diagnostic tools are often in short supply. The economic consequences are equally devastating. The rise in NCDs translates into reduced productivity, increased healthcare costs, and a diminished workforce, all of which hinder economic development and exacerbate existing inequalities. The urgency of the situation was further highlighted at the recent Global NCD Alliance Forum in Kigali, Rwanda, a pivotal gathering of over 700 delegates from 89 countries. The forum took place against the backdrop of troubling decisions by the U.S. administration to significantly curtail its overseas aid spending, impacting vital programs aimed at tackling NCDs. Dr. Gitahi, speaking from his experience with AMREF, African Medical and Research Foundation, revealed the immediate and devastating impact of these cuts. Some AMREF staff have been placed on unpaid leave, jeopardizing ongoing efforts to combat the rise of NCDs. While he expressed cautious optimism about the possibility of resuming some programs after a 90-day review period, the uncertainty highlights the precariousness of health initiatives in the face of fluctuating political priorities. The situation demands a radical shift in global health priorities. Investing in NCD prevention and control is not merely a matter of compassion. It's a strategic imperative. A healthy population is a productive population, a cornerstone of sustainable development. The global community must recognize the urgency of the crisis and significantly increase funding for NCD programs in Africa. This requires a collaborative effort between governments, international organizations, and civil society to implement comprehensive strategies that address the root causes of NCDs, promote healthy lifestyles, and strengthen healthcare systems. Failure to act decisively will have catastrophic consequences, condemning millions to preventable suffering and premature death. The time for decisive action is now. The future of African health hangs in the balance.